the best and would deliver the best for you and to you at all times. So, and I hope you've been able to pick up quite a lot of trendy stories making the rounds, as GBK has really been able to reel out. Wow. And amongst the names of the ministers and their portfolio, I was actually looking for GBK Anjorin Ojo, but I don't know, but probably in the next set of names, we'll look out for that.
Lucky me, right?
Yeah. Minister of makeups and everything.
But Olatunde, you know, I'm not a fan of, I kind of think I'm so beautiful even without makeup. I'm not like a diehard fan of makeup. Just because I need to look extra spicy for you.
You saw what Babolu did?
Oh, what did
he looked down from the back of the camera and like, uh-oh, is that GBK talking?
Yeah, no, really. I'm not on a normal day. Like, if I'm not on the screen right now, you would never ever see me with a powder on my face. I just want to be as natural as I am.
That's
you know what I say? But then just to look extra spicy for your viewers out there and for you too. So the way you just walk into the studio, you be like, James, come on, lady, you are just peppering me this morning. So that is it. So then in the course of the week, Wizkid, unfortunately, he lost his mother. That was on Friday morning.
Really? Yeah. Yesterday morning?
Yes, yesterday morning. So it was confirmed in the evening that he lost his mother.
Oh my goodness, really?
You know, these are times when we just pray that our parents just live long, live old, to really enjoy the fruit of their labor. That prayer is a prayer that I kind of feel like with children, if you still have parents, we should keep praying and praying for. But then, unfortunately, that was the end of the road for Wizkid's mother. And we wish him, our star boy, we wish him nothing but comfort to his heart and to his soul. And may God give the whole of the family the grace to bear this loss. Okay.
Yes. So we pray for, and it's well with the entire family. All right. Let's move on here. And at this point in time, there's something we need to really discuss and emphasize. This is it's more prominent and prominent to the female folk, and who would be doing this with us and for us today is no other person that knows about it. He is a consultant gynecologist from Union Teaching Hospital. It's a pleasure to have Dr. Adegboyega Afolabi in the studio with us. Doctor, thank you and good morning to you, sir.
Good morning and thank you for having me.
Good morning, sir.
What are we going to be discussing? We will be looking at endometriosis. What does this mean? Some people might wonder. Big grammar as usual, but then it's something very significant that needs total attention. And let's just introduce what this means, endometriosis, to a large extent before we begin to barrage Dr. Adegboyega with questions.
Oh, okay. Okay, it says here that endometriosis is a disorder in which tissue that normally lines the uterus grows inside the uterus. The tissue could be found on the ovaries, fallopian tubes, or the intestine. It is associated with pain, which is why early presentation is of utmost importance to avert its possible complications. Who am I? I just read that. I want him to dive in and explain better to us.
Dr. Folabi, help us out. We have a little bit of introduction as to what endometriosis is, but on a clearer note for the benefit of our viewers, what is endometriosis?
Okay, thank you very much. It is important for me to start like this. What is the essence of any life? When a life is lived in pains, in agony, and without rest of mind. More importantly, especially to the female folks, to women who on a general note will believe that they are more fragile compared to men. What is the essence of the life of a woman that is living continuously in pain, that cannot conceive, cannot get pregnant, or that's having a bad sexual life? When you remove these three from the life of a woman, you have taken almost the entire life of that woman. And that is the condition we'll be talking about today. Delve a lot into this. So endometriosis, in a layman's language, what it means is when you have what usually comes out as menses, they're supposed to be confined to the womb, within the lining of the womb, when you have it anywhere else in the body, which could be in the tube, in the fallopian tube, it could be in the brain, it could be in the kidney, it could be in the lung, it could be in the anus. And whenever the woman is menstruating every month, those areas that I've mentioned will also be showing signs of menstruation. You can imagine when a woman is menstruating, and because that condition is found in the brain, the woman is convulsing. Whoa. At the same time. You can imagine when the woman is menstruating and the woman is coughing and is coughing out blood. Because this condition could also be found in the inside the lung. You can imagine when the woman is menstruating and is also defecating blood. So this is a condition that that people don't know much about, and people don't really take it serious, because they think there are other things that seems like it, but they are not like it. They are not it. So it is important that it is when they have gone far and wide, they have seen many doctors, health practitioners, before they now come to specialists and begin to think that, is it likely going to be this? So that is, in short form, that's what is called endometriosis.
Wow. Now, what are the causes of endometriosis for a woman to have that kind of thing?
Yeah.
What could have caused it?
It will surprise you that for us as scientists, as gynecologists, there's no known cause.
Wow.
There's no known cause. However, there are theories that have been propanded. One of it is, in our language, is retrograde. It's retrograde theory. Let me just explain the layman's language. The menses that are supposed to come out through the private parts.
Okay.
When it's not coming, when part of it is going back through the tube and inside the abdomen, inside the tummy, then this one that escape inside the tummy can I escape to the brain? Can I escape to the umbilicus? Can I escape to the lung? Can I escape to anywhere in the body? And anywhere it is found, whenever the woman who is menstruating, those areas will be showing signs of menstruation too. Then some have also been, another theory has also talked about when you have these menses or these stroma and glands that are found as menses, when you find them in the lymphatics, in the blood vessels, and they escape to the brain, they escape to every part of the body, then it can also be a cause. Then also, some people have also, when some operations are done, for example, fibroid operation, hysterectomy, trying to remove the womb, if it is not well done, the lining that's supposed to, the things that are supposed to be restricted to the lining of the womb, the inside of the womb, can escape to the umbilicus. And that's why you see some people, whenever they are menstruating, they will be telling you that their umbilicus is paining them. It's getting bigger.
What is that umbilicus, sir?
The navel.
Oh, okay.
The navel is paining them. It's getting bigger.
True.
So when you begin to see something like that, that is only restricted mostly to whenever the woman is menstruating, think of endometriosis. What we call it is scar endometriosis.
Wow, that's kind of like scary.
You know, very scary. So what are the likely complications, though?
The complications that could occur, I will link it with symptoms. With what are the things that you can see when endometriosis is left untreated. Let me start with symptoms. You know, this endometriosis that we're talking about can be without symptom. That woman will not even know
she's got it.
Yes, that woman will not even know. Studies have shown that about 1 to 2 out of 10 women has these symptoms, and they don't know because it's not affecting them. But most of the women that usually come to us that they are unable to get pregnant, that they are infertile, about 4 to 5 of them ask this problem. So when a woman is complaining of pain either before her menses, during her menses, or after the menses, think of endometriosis.
Okay.
When a woman is complaining that whenever I have sex, there's this pain. No matter how I try, there's this pain. Then think of endometriosis, because that endometriosis can also be found in the private parts. So continuous pain, chronic pain, think of endometriosis. Whenever a woman, after you have done so many tests, a woman is still unable to conceive, think of endometriosis. That could it be this thing that is causing the problem? Okay. Then when it is left untreated, it can lead to severe pain, because the more they are, the more the pain. Okay. The more they are, the more they are matted together, the more they cause the organs of the body to be matted together. And the more the pain, the more the discomfort that the woman will experience. And the more of this, in some of, there was a study I did recently that I found out that when I entered for fibroid operation, but when I entered, I just saw endometriosis deposits everywhere. Wow. Thank God there were a lot of instruments to help the woman. So I just had to help the woman to burn some of them. So that what I was just trying to reduce is pain for the woman. Pain for the woman. I said this is part of what is causing the problem for the woman. It is not only the fibroid that is affecting the woman not able to get pregnant, but this endometriosis too, which the woman was not aware of it before. So it's when it's left untreated, it can make a woman to be infertile, no matter what you do. It can because it will affect the way the egg that a woman produces, the way the egg is picked up. It will affect the route at which the egg will pass. It can cause a slow motion. Wow. It will affect, even when pregnancy occurs, it will affect the way the baby will attach to the womb. So it's a whole lot. It can make the woman to be infertile. Even when the woman tries to get pregnant and she's pregnant, it can make miscarriage to occur. So it's a whole lot. It's a whole lot.
Oh, why? So
definitely endometriosis has got nothing to do with a lady who hasn't started seeing her period yet, or a woman that is after her menopause.
You see, when we are talking about endometriosis, it's about women of reproductive age group. It's about women that are menstruating. And that is why it is not common less than 13 years. It is not common after menopause. It's usually between 30 to 45 years. Okay. That's the age range. When any woman that is menstruating is prone to endometriosis. Okay. So it is not common after menopause, because the major hormone that is causing it is called estrogen. Estrogen is more during the reproductive age group, the teenage years, till the woman reaches menopause. And after menopause, this hormone that I'm talking about usually goes down, and it's the same hormone that is implicated in endometriosis. So once this hormone goes down, the risk for endometriosis also goes down.
Are there risks associated to endometriosis?
Good, thank you very much. If a mother has endometriosis, the daughter has a higher chance. 7 times risk factor.
Wow, it's genetic.
Yes.
Wow.
When a woman has delay in childbearing, has infertility, the risk is higher.
Wow.
When the woman decides to delay childbearing, the risk is higher. Especially the genetic predisposition increases the risk a lot of times. Then also, whenever our women, if you want to do any surgical operation that has to do with the womb, it should be done by a specialist, so that you don't predispose. Some people don't have it at all before, but after the surgery, they expose themselves to this condition because the surgery might have been badly done. there's a way we do it that we don't expose the lining of the womb because of this risk. Once you expose it unnecessarily, then you are putting the woman at risk of chronic pain. That's the way it is.
Chronic pain.
Chronic pain.
Wow. What are there treatment options for endometriosis?
Thank you very much. There are treatment options.
Okay.
The treatment options will depend on what you want to achieve. Is it that you just want to stop the pain? Or you want the woman to get pregnant? Or is it that you want to do surgery, that you just want the woman to be off the pain for a while before you do the surgery? Or you have even counseled the woman for the surgery and she does not agree. You just want to do something for her, at least for her to feel comfortable. Because I can't imagine a woman in continuous pain.
Pain. It is terrible.
It's crazy.
Wow. Wow.
And it is not only this woman that will suffer. The children will suffer. The husband will suffer. The relatives will suffer. And they will spend a lot. So when they will, at least, first of all, the pain must be stopped. The pain must be stopped. So it depends on what you are looking for. If it is to stop the pain, you give pain relief. Painkillers. Strong painkillers. The common painkillers will not do.
Okay.
Will not do. Then sometimes you might want to make those endometriotic deposits to be inactive. So you can give some hormonal drugs. You can give some hormonal drugs, or you can even stop the menses entirely.
Whoa.
Once a woman is not menstruating, this thing will not occur, or it will reduce to the barest minimum. Then, if a woman is looking for pregnancy and this endometriosis has already caused a lot of problems, maybe it has made the organs to be matted together. It has affected the tube, the fallopian tube. You might want to do surgeries, adhesiolysis. You might want to burn some of them. I forgot to mention that the mainstay of diagnosis of knowing this thing is by laparoscopy. Okay. Laparoscopy is just you're just trying to make a small hole. You make a small hole to look at the womb, to look at the tube, and be able to see those lesions. You see it directly. You can even treat directly. Okay. So it depends on what you are looking for that will determine which mode of treatment you will do. And depending on the age of the woman, what the woman wants, I just want to be free of pain. Please, I just want to be free of pain. Because sometimes even if you remove the womb and the woman is having endometriosis, it does not stop it entirely. Wow. What of the other ones in other part of the body
that have migrated to other parts?
So it depends on what the woman is looking for. But the details of it, you can visit us at our various hospitals.
Doctor, before we call it a wrap because of the want of time, is endometriosis, is it preventable?
I'm sorry to say it is not preventable. Wow. Once a woman is of reproductive age group, she's prone to it. She just needs to be aware of it, like we are discussing now. She just needs to be aware of it and try as much as possible to do a regular checkup, so that if there is early pickup, early, we can treat early in order to prevent the severity of the disease. However, in some occasions, like I've said before, some of the surgeries that we do, if it's not done by we specialists, can make a woman to be prone to it. Fibroid operation, operation to remove the womb, and a lot. So if we're able to prevent that, then the other ones that's not preventable, being that most women usually menstruate every month, then those ones can be easily managed. So the most important thing is early presentation and prompt treatment. Thank you very much.
Thank you so much, Doctor. And before this, I think this will be my last before we call it a wrap. Now, how soon should anybody who feels and probably viewing this and feels probably I have this, how soon should they see people like you?
Immediately. Because you don't know how far it has gone before the person even discovers.
Wow.
You don't know.
Wow.
And you don't know the stage of the disease. Whether it's still at the early stage or it has the late stage.
Man.
The person should see us immediately.
If the person is experienced, if it's at the last stage of it already, what happens?
And we manage it. We manage it, but complications might have set in. Complications might have set in, which will make the management to be more tedious and more costly, more encompassing, and then you might not get the full package of the management, because once some damages are done, some might not be totally reversible. Some might not be totally reversible.
Wow. Dr. AJIBIKE, thank you for your enlightenment. Thank you for educating us concerning this. Because looking at it, most of us will just look at it's the women that have their wahala, but then as the husband or the brother, we need to take care of each other.
If you get to have anybody around you who deals with these things, even the normal menstrual cramps, you pity them seriously. Now, imagine a doctor talking about chronic pain. I've never experienced pains before, like from when I started and all that. It's just I just do my period effortlessly, you know. But then I have women around me, young ones. You see them, they will be holding their tummy and getting to feel. So I mean, pain is not something that one has to live with. Like it is terrible, and that is what we are all about here on Spring Delight. Like just letting you to understand and keeping you in the loop, being aware of what is happening in your body. It's always an interesting edition whenever we come here and we have a doctor. You know, because so many things we are blind to.
Honestly,
they make us see more than we see, you know.
Honestly.
So yeah.
Once again, we'd like to thank Dr. AJIBIKE Afolabi, a consultant gynecologist from Uni Osun Teaching Hospital. Thank you, sir, for taking time out to be with us on the show this morning. We are honored.
Hey, you're welcome.
And that's how we'll call it a wrap. And please, let's take a cue from virtually everything, from the facts to the benefits of fruits and everything we have brought to you and for you on the show for this beautiful Saturday morning, 19th day in the month of August 2023. We'll be back again next week, Saturday. And another edition of this program, Spring Delight. Today, IDOWU is my name, at Irresistible TD.
Okay, I'm AJIBIKE ANJORIN. Follow me on all social media platforms at Queen Ajibes, and I'll follow you right back.
See you next week.
Have a beautiful Saturday.